And my name is John Riley. Whoops. My name is John Riley. I'm president of Riley and Associates. We are an independent insurance agency. We specialize exclusively in Medicare. Here's our roadmap for today. We're going to go over the basics of Medicare. So kind of a refresher. We'll go over here your two main options. So you've got two paths to choose from, and one's going to be an Advantage, which works like an HMO. The other one's going to be like a supplemental plan, which works more like a PPO. So you're going to have two different options. We'll go over those different options, and then how to choose your plan, kind of the key factors in choosing a plan one over the other. Even if you do decide, I'm going to stay with original Medicare plus a supplemental, or I'm going to go with an Advantage, there's still choices that you need to make there. You need to know that your medications are covered, that the doctors you want to see are covered depending on your plan there. And there's different options as well. So there's a lot to cover in that step. And then just to kind of wrap it up, we'll go through kind of what your clear next steps are. So a lot of this we do during the initial discovery call with our clients. So what is Medicare? Medicare is health insurance that's provided by the federal government for those age 65 and older and those under 65 with certain disabilities. Most people qualify for Medicare Part A and Part B as long as they're 65 and either they or a spouse has paid into the system for 10 years or 40 quarters. Okay, Medicare doesn't cover everything. It covers a lot, but there's still a lot of out-of-pocket costs, and we'll kind of jump into those as well. So when you sign up for Original Medicare, Part A and Part B is known as Original Medicare, and everyone's going to need to sign up for that. So whether you enroll prior to age 65, and we recommend 3 to 4 months, or after you retire from a large group plan, you're going to come off and sign up for Original Medicare. We recommend doing that 3 to 4 months in advance, just doing kind of a discovery call. Make sure that you know what the timelines are, what you need to do. We help you with all of that, and we also put together a presentation, kind of like what we're going through today, where you go through the basics and your options based on what your needs are and lifestyle, and then we get you enrolled in some of those things. But so everyone needs to enroll in Original Medicare, or if you're already receiving Social Security benefits before turning 65, then they'll automatically enroll you. But for everyone else, we need to enroll, whether it's before our 65th birthday or when we're before we retire. Okay, so Part A is your hospital insurance. This covers inpatient stays and skilled nursing. Part B is basically everything else. It's your doctor visits, your labs, your x-rays, diagnostics, even outpatient surgery. So Part A and Part B is known as Original Medicare. There is no premium for most people for Part A, and there's a small premium for Part B, which is $202.90 here for 2026. Okay, so some people will want to stay with Original Medicare. They're going to have to add a prescription drug plan because Original Medicare doesn't cover drugs. Even if you don't take medications, you still need to get a drug plan because otherwise you get a penalty. But there are plans right now that are zero premium, and so you can do that. But if you stay with Original Medicare, you can add a Part D and then a supplemental plan, which is going to cover a lot of the out-of-pocket costs, which we'll look at here in a minute. Or your second option is the Advantage plan. A Part C or Advantage plan, the same thing. In Part C, Advantage plan, it works like an HMO. It's an alternative way to receive Part A, Part B, and it does include Part D. So if you're on an HMO now, either with an employer or say you have an individual HMO plan, it's going to work much the same. Everything's going to be all built into one. The nice thing is whether you stay with Original Medicare, add a supplement in Part D, or you go with an Advantage plan based on your preferences and budget and lifestyle, the benefits are going to be a lot better here. So it'll be really nice. So we'll take a look at that here in a minute. For now, let's go ahead and just show you how Original Medicare works. So if you just get your Part A and Part B, and you don't get, a supplemental, then you're going to go to your provider and your services, they're going to go ahead and bill Medicare. Medicare is going to go ahead and pay their portion to the provider and then bill you for the rest. So there are deductibles, co-pays, and co-insurance that aren't covered by original Medicare, and there's no out-of-pocket maximum. That's why you generally people are going to select one of two options. They're going to stay with original Medicare, get a supplemental to pay for these things, as well as a Part D plan to make them, complete, or they go with the Advantage plan. So let's go ahead and take a look at both options. Okay, so option one here is your original Medicare. So with the original Medicare, you've got Part A and Part B. Like I said, you've got these out-of-pocket costs, which we'll show you how to cover through adding a supplemental plan, which will pick up those costs, plus a Part D. So if you went with original Medicare, then you would get a supplemental to pay for your deductibles and co-insurance, give you an out-of-pocket maximum, and then you would add a Part D plan. And that would give you a really good comprehensive plan. You're really only going to have one out-of-pocket cost, which is $283 for your Part B deductible. So your out-of-pocket costs here are very minimal on a supplemental with original Medicare. Okay, your other option here is option two, which is a Medicare Advantage plan, or Part C, and that works like an HMO. It covers Part A, it covers Part B, it includes Part D in the plan, and offers extra benefits as well. And we'll go over those a little bit here shortly. Okay, so with original Medicare, you've got two options. You can add a supplemental and stay with the original, or you can go to Medicare Advantage, which works like an HMO. Okay, so we'll jump into some of these costs here shortly. So with a Medicare supplement plans, essentially you're reducing your financial risk of uncertainty in medical. You only have that $283 premium or not premium, deductible for Part B, excuse me. So you just have that Part B deductible. That's all you pay. Generally, you're going to pay that at the beginning of the year when you first use your services. And then once you pay through that Part B deductible, then you're done for the year. So this also gives you a lot of flexibility. So someone that wants the ability to go to any doctor, any hospital throughout the nation, and not be in a network, then original Medicare plus a supplemental is the way to go. And there's no referrals required, no prior authorizations. If Medicare pays, then the supplemental will pay. So they don't get involved in your business at all in terms of insurance. And then, like I said, it requires a separate Plan D prescription drug plan. Okay. Now, if for a Medicare Advantage plan, those are popular because you have a very low premium. For most plans here in California, it's actually a zero premium, and you get a lot of extra benefits like dental and vision, things that you would pay for, or your employer would pay for. So you've really only got two major out-of-pocket costs. When I say major, I mean, $150, $200. It just depends on the plan. But for ER and for ambulance, those are your two main charges. You might have some small co-pays, but other than that, with this plan here, you're going to have a very zero to a low premium, very low in the way of co-pays. If you're on an HMO now, this is going to just be a tremendous benefit for you, because you'll still be able to go. If you like UCLA, you can find a plan that goes to UCLA. You can, if you want to be with Cedars, you can do that. If you want to be a PIH or Providence or a Torrance, those are all options with an HMO. So similar to what you have now, you're going to have those same options. It's just a matter of finding the right plan to fit that network that you're in. And so you would have a primary care physician who directs your care and be part of a community network of providers. And it includes your drug plan, which is really nice. Your drugs are included. And again, a low out of pocket. Generally they're around 300 to 500 for most plans here in 2026. Some are a little higher, but most of them are in that range. So really, when you compare both plans, either supplemental going that route or the Advantage, they're about the same out-of-pocket cost. I mean, 300 to 500, and it would be difficult to reach that on a Medicare Advantage plan. So really, really good coverage with both options. Okay, so here's your two options, two different paths. So if you're on a PPO now and you want to stay that route to have the freedom to go to most doctors and hospitals, then you're going to want to go with option one with a Medicare supplement to pay for the out-of-pocket cost plus a Part D prescription drug plan. Option two is if you're on an Advantage plan now, or an HMO, excuse me, if you're on an HMO plan now and you like the plan and it's working well for you, then you can go with an Advantage plan here. It's going to work just the same. It's just going to be better benefits and lower costs. So you'll really like that option if you want to do that. And there's some things to know between the two. So that's why having, an agent and setting up a discovery call and going through a presentation like this. And that's what we do, so that you understand not only the basics, but some of the rules around, making a decision and, getting you enrolled and taking care of you. So this slide here is just kind of a comparison between an Advantage and a supplemental. So an Advantage, again, low premium to zero premium for an Advantage HMO plan. You have a very low out-of-pocket cost. You do have a network, so you're going to have to, get referrals sometimes for specialists or pre-authorizations, kind of what you're used to if you're on an HMO, and then the drug plan's included. Which is nice. So similar to what you have now. If you decide, hey, I want the freedom, I don't mind paying, a monthly premium for a supplemental, I want that freedom to go to any doctor, any hospital, then a original Medicare with a supplemental is the way you want to go. So you're going to pay, anywhere from 150 to maybe 250 for your supplemental plan, depending on when you come in, what age you are when you come into the system. Your out-of-pocket costs are minimal. Like I said, they're very similar. This one's maybe 300, this one's 300 to 500, and so very low out-of-pocket costs. Your provider network, like I said, nationwide. Go to any doctor, any hospital in the nation. There is no network, and most doctors, providers, they all take Medicare, which is really nice. And no referrals required, no prior authorizations, no insurance, getting involved in your business. So that works out real well. And then you'd have to get a separate drug plan. Okay. All right. And let me go back one sec. On the drug plan, even if you don't take medications, you might say, hey, I'm healthy, I'm not taking medications, I don't need a drug plan. You do. There's some that are zero premium right now, but if you don't pick up a drug plan when originally coming in, you've only got 2 months to get a drug plan. Otherwise, you're going to pay a penalty. So that's important. I just didn't want to miss that, but we're happy to go over those things with you in person. But, okay, so the key factors really is just it's monthly budget. It's what's your health. Current health conditions. So what are your needs there? Preferences in terms of doctors and hospitals. Do you mind a small network, or do you want something that's very flexible? Do you travel a lot? And just risk tolerance is not too much with either plan. Like I said, it's very low. But there are some things that you'd want to know about the two different plans. So, there we go. So anyway, again, this is a little redundant, but it's just it really comes down to, what your budget is, what your health is, what your lifestyle is. And those are things that we would go over with you during the discovery call, where we get to know you, understand what plan you're on and what your plans are in the future, as well as doctors and medications. So making sure that everything fits, there's no surprises, that sort of thing. biggest mistakes, that people will pick a plan based on cost, like they'll pick an Advantage plan because there's no premium there, and they get extra benefits, but then they realize they have less freedom, something like that. Um, just the difference in costs and how your health affects the plan that you're on. Those are important. And then one that's not on here is timelines. That's really important. So that's something that you want to know. You want to know what your timelines are so you don't sign up too late. Okay. So what's, how to make the right choice. That's why we recommend, having something that's structured. We've got a system and structure for everything. So we have a discovery call, then we put together a presentation. We go over Medicare, we go over your options, make sure you're solid, you know what you want to do, and get you signed up. And then we educate you along the way, everything that you need to know. And then we have like an orientation meeting to make sure you understand your plan, you can access all your benefits and some of the things that Medicare doesn't cover. So really important. But we're going to review your personal situation. We'll compare plans side by side, and we'll give you guidance. That's why we're here. Okay. What to remember, just as we kind of wrap up, a Medicare Advantage plan generally has a 0 to low premium. So you have a lower out-of-pocket cost here, and generally, but a little bit more, you've got a network and a structure to stay within. On a Medicare supplement, you're going to have a higher monthly premium, but it's going to give you a lot of flexibility to go to most any doctor or hospital in the nation. So both of them are really good fits. I mean, if you're on a PPO, you're going to love the benefits on a Medicare plan, a supplemental with original Medicare. If you're on an HMO, you're going to love the benefits and costs again on the Advantage plan. Both are excellent options. It just comes down to, what's my budget, what's my health, what's my lifestyle, things like that. And those are things that we help you understand, and so you can make the right decision. Okay. If you want to know more, we do jump into kind of more in the basics every other week, where we kind of take a deeper dive in how Medicare works. Enrollment timelines, like I said, that's super important. We do see people that miss their timelines, and then they're going to pay a penalty, and they have a gap in coverage. You don't want to do that. That's why you have a discovery call 3 to 4 months prior to either turning 65 or coming off your large group employer plan for retirement. So that's really important. And we don't charge anything. There's, we get paid by the carriers. It's all overseen by CMS. So whether you go direct to a plan or with us, it's the same price. So you're better off working with a broker that specializes, that knows all the rules, that has a team to support you and make sure that all your I's get dotted, T's get crossed. If you're a planner, you're going to love us, because we got a system for everything and a process for everything. We have a real passion for Medicare, so we can handle all your questions, answer all your questions. So anyway, hey, thanks for joining us today. I hope I answered all your questions. You can go to MedicareSouthBay.com. That's our landing page for John Riley and Associates for consumers, and then that way you can schedule a call with us. There's a lot of videos on there in other subjects that you might be interested in. And or you can email me or give me a call. But what I recommend doing, like I said, there's no cost for our services. Set up a discovery call if you want to work with us. Then we take you through the whole process. We set up a presentation, we go through your options, we get you enrolled, we make sure that you're educated, confident, and you know what you're doing. And then we continue to take care of you year in and year out as things change. Your health changes, medications, doctors, all of that. So that needs to be reviewed each year. So we do that with you as well. And there's, again, no obligation. So reach out to us. We'd love to talk to you, and we appreciate you. So have a great day. Thanks.